Well, welcome back to The Short Coat, coming to you from the amazing and intense world of med school at the University of Iowa Carver College of Medicine. I'm Dave Etler, and this week we're talking about medical students' families. They mean well, and their support is always welcome and needed, but sometimes it's hard to explain to them what this med school business is all about. Let's talk about that with my co-hosts, like M1 Anna Royer.
Hello.
M2 Srishti Mather is here.
Hello.
We've got M1 Drew Bolasay.
Hey, guys.
And M2 Nick Abuasali.
Hi.
Abuas.
There you go.
That's going to be the whole podcast. is just Dave saying that.
Guys, I'd like to start with what your family thinks it means to be a med student. So when your family says, how's med school going? What answer are they expecting from you?
I think they're expecting that I'm already a resident. They're like, how's it going? And like they want to know that I'm doing medicine. You know, they think I'm like on the wards.
Okay.
Even though I've explained 1,000 times how the preclinical route works, they think I'm doing clinical right now.
Okay.
Yeah.
All right.
That's my initial.
You're an M2.
I am an M2.
So you're not there yet.
I'm
but
not there yet,
You're
no.
almost there.
I am.
Not as a resident,
Which is a
but
little
as
terrifying.
a clinical student.
Yeah.
Nick, do you have the same experience or?
I would say it's pretty different for me, actually. I have the benefit of having some doctors who were in my family who went here. So they're like somewhat familiar with how things work here. And they understand that like I'm still in school, but I think they expect that I am constantly studying like 12 hours a day all the time. And won't lie, that definitely does happen sometimes. But I think they're pretty shocked to hear about how much free time I have and how much time I get to like spend with friends and like going out and stuff like that. I feel like
when were they in med school though? That's
back in the 90s. So
yeah.
Been a little.
I wonder why. I mean, there's more med school to learn
Mhm.
now than there was back in the 90s.
Mhm.
There's more medicine to learn. I wonder why they were going so hard at it.
Yeah, I don't know. It's very interesting. They make it seem like it was very cutthroat back then, whereas I feel it's so positive here now that like there's just so much support here that I almost feel like I can't fail while I'm at Carver. Like you guys won't let me fail, which is not that I want to fail, but you know, like you guys just support us so well that I feel like I at least sometimes get to live like a regular life.
Yeah.
Like I go out more now than I did during undergrad, which feels kind of crazy to say.
Yeah.
And I'm doing well. So.
Yeah.
You guys, you M1s.
Yeah.
How you guys have only been here for like 2 months.
Yeah.
Mm-hmm.
Yeah.
How are you? What do your families talk to you about med school?
Yeah. I don't come from a family that has really anybody working in healthcare. So this is very new for everybody. I think that my family kind of thinks that I'm like still in college. Just in the sense that I'm kind of talking about the same things, like, you know, going to class and going to lab and whatnot. But I think there's been a barrier in that, like, I'm not at that point yet where I'm like having a ton of free time or like I haven't really struck a really good balance yet between studying and like, you know,
I will say,
just
like,
living life.
When you get into like M2 or like even like when you finish your first semester.
That's
that
what I've heard. Like
increases.
there's definitely a light at the end of the tunnel, I think. But yeah, like for now, I think it's hard to kind of explain like how much harder I'm working now than I was like in college.
You guys are in the thick of it right now, and it takes a little bit of time to like get that schedule like, you know, figured out, but you'll get there for sure.
Yeah.
Mm-hmm. Yeah, I think for me, similar to Nick, I have the benefit of having a dad who's a physician, so that has really helped a lot in terms of understanding where I'm coming from. And also my mom's a nurse, so I feel like she understands the whole healthcare system and what goes on. And I feel like even just having one parent that's a physician, like they're able to tell the other parent like kind of like what's going on, understand my life. So that helps a lot. I feel like one thing that really helped a lot for me too was taking gap years at home, and my parents like just saw how hard I worked all the time, And I feel like that gave them like a big glimpse into my life, because like I was working hard during college, but like they didn't really like understand how hard I was working, I guess, until like I was at home like working hard all the time. They're like,
What were you doing?
just like so I did 2 gap years, and then so I was just like working at my job, and then I'd like as an MA, and then I'd come home and then like work on my applications, or like I would do just miscellaneous tasks, like coordinate with like my research PI in undergrad, like try to get like my publication going, or like coordinate with like volunteer organizations like that I worked with to like develop new projects, like stuff for my resume and stuff. So I was just kind of like working around the clock, and like I feel like them like seeing that like now lends so much understanding into where I'm at right now. Like they know I'm working just as hard. And I also feel like one thing that I like is that now that I'm in med school, like people like know I'm busy. Like in college, like I feel like I was just as busy. I mean, like don't get me, actually no, I'm definitely more busy right now.
Yeah.
But like in college, like I was like, obviously as a pre-med, like you're super, super busy. But like I feel like people like you can't really like have any slack like in terms of like developing your application if you want to get into med school. And I feel like in college, like people don't understand that as much. Whereas like once you're in med school, people are like, oh, well, he's in med school, he's definitely busy. So I feel like people leave me alone a little bit more, and I kind of like that.
Yeah. There's definitely some like credibility that comes
So the
with
trick
it.
to having people leave me alone is to go to
higher education. I will say one thing that like my parents and I always like struggle with and butt heads with is my immediate family. There's no one in medicine, so like I am the first to do this, and they do not understand the concept that like I don't get the same days off or like the time off that they do. So like I worked in a scribe position previously, and like my hours were pretty intense, and like I wasn't getting, my mom like works at a university, she's getting like winter break off, and she's like, why aren't we going and doing these things? And I'm like, Mom, I have a job. And she's like, well, you can just let it go for now, like we can take a day off. And I'm like, that's not how healthcare works.
Take a day off.
Just take a day. She's like, it doesn't matter, the patients
Call in
don't
sick.
need you, they don't need you. And I was like, I mean they don't need me objectively, but like there's an expectation in healthcare because of the nature of the work of like, you know, you're working different hours, there is like a need to be present, and that was something that I always butted heads with my family with. And like even with core year coming up, they're like, oh, we can like do something for Thanksgiving next year, and I'm like, no the hell we cannot. I can't, you can, I can't. So I think that's something we've kind of struggled with a little bit, is that like expectation.
What is something your family thinks you've learned here that you have not?
Of
You
medicine.
Absolutely have not.
I was just saying this. My parents, like my dad, like was like, "Oh, my heart's beating fast. Do you know what's going on?" Or he'll like show me his like EKG, and I'm like squinting at the lines, trying to remember what they taught us last semester, and then I'm just looking in the corner and reading what it says it does. Like I don't know medicine like that yet. I don't know it like that yet.
Oh, poor dad.
It's okay. I looked it up. I looked at my notes.
I definitely I have some extended family who is like, cannot be convinced otherwise that I'm not in nursing school right now. So that's one thing that like, and I guess like on my in-law side, I have a lot of nurses there. So it's like probably a kind of benign misconception, but you know, it's like,
You know.
I'm not learning those things that you're talking about. And then I also have some like my grandpa, for example, like I think he thinks that I know surgery. Like the reason that this came up was he got a CD stuck in like he has like an old panel truck that he like, you know, piddles around with. He got a CD stuck in it, and so on Amazon he bought like a pair of hemostats to like get it out, and then he like gifted them to me, or maybe it came in a pack of 2 and he gave them to me, and he was like, this will like really come in handy. And I was like, I don't think I can bring those into any operating room,
Hey.
let alone use them. We're like, what?
I can imagine.
But I said
like,
thank you.
Showing up
but,
in like a scrub text, like absolutely not.
no, literally.
brought my own hemostat.
Just like gonna go rogue and
You can just like pick up the stylus for your like tablet or something.
No,
Your
yeah,
hemostats
find a
and
purpose
stuff
for
like
it.
No,
that,
literally.
yeah.
I'm using it to cook. I'm using it to like pick up my things so I can cook food.
You know,
Yeah.
here at Iowa, this is sort of a tangent, but here at Iowa, they have a surplus organization where, you know, right now, if you need like an office equipment thing, you could go there and maybe they would have it. But back in the day when I first moved here 20 some odd years ago, they were selling things like ventilators and EKG machines and all kinds of stuff. Now they sell that stuff online.
I mean, that would be helpful. My dad would show up and I'd be like, why don't we run an EKG now in my tiny little apartment?
Let's do that.
No.
Yeah, you could buy hemostats, you could buy like scalpels, you could buy whatever the heck you wanted that came from a hospital. I've got a couple of stainless steel bassinets in my house. Bassinet, what do you call them? Bases that I use for shelving in my house.
That's incredibly weird.
It is weird, but it kind of looks cool. But anyway, point is, back in the day, you could go get an anesthesia machine and be like, okay, Grandpa, let's do that surgery that you need. Okay. Has a relative ever given you advice, medical advice, or checked your work or something like that?
I mean, I have this ongoing argument with my parents where like they utilize WebMD. And then we're talking about something like me having a cold. And they're like, this is because of X, Y, and Z. And I'm like, well, who's getting the degree?
Yeah.
That's the most I can think of.
Okay.
I don't know about checking your work.
I think I could maybe chime in on this a little bit. A really big and frustrating thing that like I'll deal with in my family sometimes is if my parents aren't feeling well, or like if my grandpa's not feeling well, they try to hide it and don't want to go seek like medical attention. And I'm very much a proponent of like, no, like something's wrong, go get help. And that I think is really, really frustrating to deal with, especially when we're learning about all these conditions. The big one being my grandpa. He's 87 now and just a terrible, terrible listener when it comes to that kind of stuff. Like the man lived his life taking care of his family, worked 3 jobs. Like he's always been a very independent, hardworking person. And I think like trying to be like, okay, maybe we need to take the foot off the gas a little bit. It's time to relax. Let us take care of you. I think he tends to push back on me on that quite a lot. So I guess that doesn't.
So he's like, you're like, hey, Grandpa, maybe you shouldn't, climb that ladder.
Yeah.
To take down the Christmas lights because you could fall and break your hip. And he's like, oh, I'm fine.
Basically,
he sounds exactly like that, I'm assuming.
Yeah. Like, fallen 3 times in the past month and a half. Maybe you should go see a doctor.
Yeah. Okay.
Yeah. And
I don't need a doctor.
Exactly.
Exactly.
Yeah.
Exactly.
Just frustrating.
All right.
No, yeah, I think it's sometimes like I am getting this education. I do have again, I'm not going to be able to diagnose you right off the bat, but I do have the pattern recognition skills to know like we should get this checked out. And sometimes I get a lot of pushback on that. And I'm like, well, again, what am I paying out of my ass for?
Yeah.
Yep. And I think it's hard when you come from like a very like paternalistic family where it's the adults always know what's right sort of and don't listen to the younger generation as much, especially now when that younger generation is becoming adults and is, becoming professionals in these careers that they're interested in. So I think it can be kind of hard to like get the older generations to like listen to you,
Yeah. Yeah, I got news for you. It's that also happens outside of medicine. But it's fine.
Yeah.
It's fine.
Yeah.
I always say, sometimes you got to set expectations for your parents and tell them this is how it is.
Yeah. You just got to keep
This
trying.
is what I'm doing. It works out.
Yeah.
Health policy is one that always gets like big
Go
pushback.
deep.
There's a lot going on.
There's a lot going on and I don't agree with most of it. And and sometimes that makes for really uncomfortable conversations with,
That's fair.
family members who aren't as like maybe entrenched in like
we can go into it a little bit. We
like,
can go into it. Like what's an example?
oh, I don't know, perhaps like vaccine policy with the,
God, that feels like the old standby now. That feels like
I don't
know how like oh, that's how it's always been,
Yeah.
but it really
It
hasn't.
wasn't. I have a family member who like very, very, very strongly believes that doctors like cause cancer to make money. And that's like one that I've had to like try and like reason with them about.
The conspiracy theory of it all.
Yeah, that's a conversation I've had multiple times, which very interesting always.
Yeah.
What part of med school do you think your mom is secretly proud of? Or whatever parent you want to, whatever family member you want to substitute.
This, I guess, kind of came up like prior to med school. But it was probably like one of the most important things my parents like ever said to me ever, like along this journey, was like, you know, just trying to like apply and do everything and like prepare for the MCAT and all that stuff was like so unbelievably stressful. And I just remember before taking the test, my parents were both like, hey, we just want you to know, like, we are like, no matter what happens, like, we are so proud of you because of how hard you've been working for this. And like that, I guess that just them acknowledging like how hard that we work, I think is like huge. Like that, I think really meant the world to me and very much has like motivated me like from that point on. And that like, I know like being here, like I'm making them proud. And yeah, working my ass off for it.
Nice.
So.
Yeah.
I love that.
Yeah.
It's very sweet.
Yeah, I agree with that. And we've talked about this, but like,
Mhm.
it's not very common for our parents to say stuff like that to us.
No?
So no, not really. So when it does happen, it's at first, I know it's very meaningful when they say stuff like that. And I know they really, 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 truly mean it, because otherwise it's like pulling teeth to get a compliment. But like otherwise, like like when in those moments where they're like, we are actually very proud of you and you are like, you're making us proud to be your family.
Mhm.
Like those really mean something.
Right. Like I feel like coming from like a pretty like paternalistic family, like I had said like previously, it can be hard to be like emotionally vulnerable with your kids when it's more so like you just want them to listen to you because you've lived a very full life, like the mistakes that you've made, you don't want them to make those mistakes and stuff like that. So I think it can be hard to like take a step back from that and just be like, yeah, emotionally vulnerable like that and like connect with your kids. So when that does happen, it like means everything.
Yeah.
Like I'm never going to forget that.
You guys want to say what your background is, what your ethnic background is?
I'm Indian.
Yeah.
And I'm
No.
Lebanese.
Okay.
Yeah.
Similar.
Very similar cultural
Situations.
backgrounds
Mhm.
there, yeah.
What about you guys?
My ethnic background?
No. What would?
I was confused about that.
I'm
too.
gonna. No, you look pretty white to me.
Yeah, that's
I don't want to make any broad generalizations, but
100%.
no.
I'm sorry, what was the question?
I meant.
I don't think
what do
Dave
you?
knows either.
What do you? Yeah. What do you think What do you think your mom is secretly proudest of?
Oh, I don't know about secretly proud. She's pretty, like every time I go home, she's like, I'm so proud of you. Like,
Oh,
this is so cool. Yeah.
does she introduce you to other people? Like, this is my daughter, the med student.
Yeah.
Oh yeah, that happens so much.
Yeah.
That's okay.
Feels good when your parents brag about you a little
Yeah.
bit, you know?
For sure.
Yeah.
Yeah. No, but I grew up like my two younger brothers were pretty medically complex. And so we were in like hospitals and doctors' offices a lot. And so like when I was younger, I never really expressed interest in going into medicine. And I think my parents, although they never like pressured me into going into medicine by any means, I think they're secretly maybe a little bit proud that like eventually, with like years of school and training ahead of me, like I'll get to be the one who's like helping other families like that. We've never like chatted about it though. We're also not very emotionally vulnerable with each other. So
Okay.
yeah, that's just my my perception.
So my dad, he's an endocrinologist. So for me, like my background is kind of an interesting case because I'm multiracial. So my dad's Filipino, my mom's white. I think it's always been really interesting for me in my life because like my dad's background is kind of like, okay, like you don't like really express those emotions as much like to your loved ones, but then my mom's background is like you express it like all the time and like very, very open. And so like, but it's never like a difference that I really noticed because like that's my background, is like being exposed to both of those things like my entire life. So it's always just seemed very normal, like one way or the other. And so like I can just recognize that like both of like the ways in which they do that to me like is like equally as loving. So it's like it's interesting because like, you know, like me being in med school, like my mom will always be like, oh, I'm so proud of you, or like not really like because I'm in med school, because she knows I'm working hard. Like I think my parents are like very supportive like in that aspect, where like their proudness isn't tied to like my accomplishments or anything like that. Like it's tied to like, do I try my best every day to like be the best version of myself? And so like I think like that's what my mom is most proud of, like is like that I'm just trying my best every day, and like she verbalizes that. And like for my dad, like it's interesting because like for him, like he is a physician, and so like he is, we've always just had like a very deep bond in terms of like me following in his footsteps. And like I could just, you know, like it's just you just know that like it means the world to him, because like he sees himself in me, and he knows like how hard it is to get to this point.
Yeah, you said you had doctors in the family too. Is there any pressure at all to go into a certain specialty or not?
No, so the doctors in my family are like very supportive of do whatever you want to do, which I really appreciate. Like they're very much encouraging me to explore my options, which has been really, really nice. I mean, they joke here and there about like, oh, you come, you know, to like our clinic for this or that or whatever. But no, they haven't really pressured me, which has been nice because I'm interested in a specialty that I don't think any of them have much experience with.
Oh,
so,
okay. So what specialty?
Neurology,
Okay.
I think, which just kind of came out of nowhere.
Yeah.
So, yeah.
Did you come in with an idea?
Yeah, oncology. I worked at the hospital in the hem-onc unit for like 2.5 years during my gap years, and like my grandmother also died from cancer, and I had a little cousin who had Ewing sarcoma. He has a below the knee amputation, so like cancer is something that's very personal to me. But I have just like fallen in love with the nervous system and the brain, and it's just so fascinating to me. And I shared that with them the other day, and they just blew up we have our like doctor group chat. Aww. And they just blew it up with like, here's all these recommendations, here's all these neurologists we know, like so much stuff. Which was
you got to admit, having a family of doctors
helps.
It's
nice. It's
a nice support system.
Yeah. You should be able to rent out your doctor family.
I agree. I
to
would
others
love
that don't
to pick-
have doctors in the family, you know?
Yeah,
I agree with that.
Yeah. That was something I really struggled with, especially in my application process, was that of like just not having doctors in the family. And I think
it's hard to know what you're getting into.
It's very
what you're
hard to know,
do.
just like the little details.
Yeah.
The little things. It's very difficult to navigate that without any sort of support. But like again, my family did the best they could, and we have extended family who are in medicine, so I wasn't completely without that.
Yeah.
But I do think it makes a difference. Yeah.
Well, Shortcoats, if you have something you want to say about today's show, about something you want to hear someday, question you have, go to theshortcoat.com/tell us and send us a message. Otherwise, that's our show. Until next time, I'm Dave Etler saying don't let the bastards get you down. Say bye, everybody.
Bye.
Bye.